Hello everyone, it's Dr. Mohsen Raza once again. Welcome to my new YouTube channel related to the most common diseases seen in the society. Today I am going to tell you about the very most common thing that we face in our daily life is epistaxis. So what is the epistaxis? As you all know that the bleeding from the nose is known as epistaxis. Now there are different causes of epistaxis. The most common of them I am going to tell you are like the nasal septal defect. The next most common is any trauma, direct trauma to the nose, or it can be any basal metabolic disease which causes the bleeding from the nose. Now one by one I will give you a very small description about these three things. First of all, nasal septal defect. Now what happened in this situation? In the nasal septal defect, due to the deviation of the nasal septum, the airflow becomes turbulent, which causes the dryness of the nasal mucosa, and which results in the rupture of the blood vessels, and which causes bleeding. So this is the nasal septal defect. Now the next is most common situation is a trauma. Drug trauma can definitely cause the bleeding from the nose, which there is no need of explanation about this thing. And the next most common cause can be the hemophilia or any other coagulation disease which cause bleeding from the nose. Now these are the most common causes. Other causes can also be possible. Because of shortage of time, I'm going to explain you only these three. So the thing which most of the patient ask from me about this epistaxis is what should we do at home before reaching to the hospital in this situation. So I just says that if you have epistaxis or the bleeding from the nose, the first and foremost thing you should do is to hold the nasal tip like this between the first two fingers to very tightly for at least 15 to 20 minutes to stop bleeding. Once it's stopped, then you can easily go to the hospital. Let's suppose it do not stop, but you should keep holding the nasal tip and go to the hospital at the same time. So this is the simplest thing you can do at your home. So what happened next in the hospital? Definitely you should visit emergency department of ENT, ear, nose, throat. The doctor there will examine you, and the thing we do in this situation, first of all we put the shrinkage. What is the shrinkage? It is the mixture of the lidocaine and epinephrine and then we put the cotton swab into this liquid and then exerts inside the nostrils. Now this cotton swab remain at least for 20 minutes, and due to the epinephrine and lidocaine, it caused the vasoconstriction which stopped the bleeding. After 20 minutes, the next step doctors do is to find the site of the bleeding, which is done with the help of the headlamp or any speculum, nasal speculum, to view very correctly. Once the site is found, then what we do is a cauterization, that is the burning of the bleeding site. It can also be stopped. It can also be stopped with the help of a Surgicel, which is a special cellulose material which covered the bleeding site and stop the bleeding. So this is the very common information. Everyone should know about this, and can stop the bleeding and can help himself by knowing the information. So if you have any other question regarding epistaxis or nasal bleeding, please put your comments in the below the video, and I will answer you as soon as possible. And please don't forget to subscribe my channel and share with other people. Also ring the bell icon to keep in touch with me. Thank you so much.